Kenya is ya.
Hello and good morning. Welcome to WDRBmedia, the voice of the community. I am your host, Doc Bowman, and it's been a long time, guys, so I am finally back in full effect, and we are slowly getting back out into the world. This is your show, Discover the Best You, and today's sponsor is Discovery Chiropractic and Wellness Center, and you can find my office at discoverychirowellness.com. That's Discovery, CHIRO Wellness.com. And you can also find me on Instagram and Facebook at dr.lbowman. That's dr.lbowman. So you have any questions or any health issues that you want to discuss, don't hesitate to reach out to me. So today, I have a great friend of mine that is on the show, Mr. Cornell Wright. How are you, Cornell?
I'm good. How are you?
Doing good. Thank you so much for being on the show. Again, today has been, not today, excuse me, this year has been crazy for 2020. And, I wanted to definitely bring you on the show to discuss about health disparities dealing with African-Americans. I'm actually going to bring you on 2 of my shows. So this will be the first session today. Tell them a little bit about you.
Okay. Well, my name is Cornell Wright. I am the Executive Director of the North Carolina Office of Minority Health and Health Disparities within the Department of Health and Human Services, where Dr. Mandy Cohen serves as Secretary and Mr. Ben Money serves as Deputy Secretary for Health Services. The work that my office does is centered around making sure that historically marginalized, minority, and underserved populations and communities get the resources, program services, and other things that they need to improve their health and well-being across the entire spectrum of health and healthcare and well-being.
Very nice. How long have you been with the North Carolina Department of Health?
So I've been in this position since 2015, so a little over 5 years now, and but have been doing this type of work, for years.
Wow. Yes, you've been very majorly busy with the community, especially you've done TED Talks. I'm actually going to link one of your TED Talks on the YouTube link of this video and on this radio station. And so I definitely want them to check you out so they can see the different things that you have done. So basically, I wanted to bring you on the show again to talk about health and disparities, especially what you have seen thus far affiliated with COVID-19. And, unfortunately, with the African-American community, we just don't have health insurance. And that's something that I see, especially in my practice. That's why with me, I try to make it economically easy on both ends, people who have health insurance versus cash. But because of the fact what's going on with COVID-19, and because we don't have health insurance, what you're finding that a lot of us are too afraid to get tested. And then once we get tested, we're just afraid to go to the hospital. And so I just think personally, I think that's one of the reasons why, you don't see with the African-American studies that you don't see us get tested like we should. And I think it's just mostly out of fear. But what's your thoughts about that?
Yeah, you said a mouthful. I mean, there's so many different variables that are at play. Recently, we were talking to some people about how historically certain populations have been, and I don't want to say program, but
you can speak your voice here. You can speak what you want to say.
I mean, but for lack of a better term, we've been conditioned as a people to adhere to certain guidances, right? For survival's sake. And so a lot of times when you see like the governor or DHHS secretary, Dr. Cohen, come out and express guidances for COVID, you're going to see and hear or relate more to those who probably are adhering to those guidances, because for us, it's more of a survival mechanism.
Mm-hmm.
We don't want to be out of compliance because that's another strike against us, which could
Okay.
lead to us, dying. And
Right.
so, some of the more simple guidances that we're seeing are connected to, wearing face coverings in public,
Mm-hmm.
washing your hands, and then practicing physical distancing
Right.
in terms of being out in public as well. And so for us, it's a matter of survival at a
Mm-hmm.
greater sense than you may see in other populations that have this privileged perspective of saying, no, I'm not going to do that. And when you look at the numbers, African Americans make up about 21 to 22% of the population in North Carolina.
Mm-hmm.
Um, and when you look at the COVID cases now, it's kind of calmed down a little bit in terms of what we're seeing in terms of positive cases, but it's still an overrepresentation of the population size in North Carolina and the deaths. And so that's where we still see some issues. And a lot of that has to do with people with pre-existing health conditions, and just not getting the proper care and treatment that they need to deal with those issues. And then you add COVID on top of that, and it's a recipe for disaster for our communities.
Yeah, for me, what I've seen is probably a little opposite in my opinion. I feel like in the more of the upscale areas, you see more people wearing their masks versus in the lower class areas, people were not wearing their masks. This was before it was mandated.
Mm-hmm.
And that's what I was paying attention to and noticing. And I don't know, was it because of the fact that it was a lack of supplies in those neighborhoods that those masks were
Right.
not there for them to use? It's not like they didn't want to, it just wasn't there for them to have.
Mm-hmm.
So that was one of the things that I noticed. But because of that, that's where I felt like you were seeing more of a high population of other ethnicities, such as the Hispanic community and the African American community, catching the cases a lot quicker. That's what I was seeing on my end. But, again, that testing part, I've seen situations where the people will go get tested and they'll come out with a $1,600 bill.
Mm.
And then this was actually a relative of mine with a $1,600 bill, and then turn around and then their hospital bill by itself was $5,000.
Mm.
And she didn't have health insurance. She lived up north. And so I just feel like, compared to other countries like France, for example, Canada, for example, you have these free healthcare systems where they were already in place for the citizens. People were more prone to be willing to go get tested, more prone to be more safety precaution, and more prone to be able to make sure they do the things they're supposed to do, because the government had it mandated where they were going to make sure they get well taken care of regardless. And I just don't think that the United States has been very well equipped, affiliated with health insurance and health care. I don't think they've been very well equipped when it comes to situations like this, even all the way down to the economy by itself. And I don't put that against one party versus the other. It's just as a whole in the government span, they did not and do not have the standards and the means to make sure that their citizens are getting taken care of. And I just feel like they need to take everything and basically break everything apart and put it back together. And because like even in Canada, they were getting a good standardized check, I think, almost like $4,000 or $5,000 a month, affiliated with just making sure that they stayed at home and was making sure that they were getting taken care of. But so it's interesting that your perception with the African American community is that we were definitely making sure we were doing the things that we're supposed to do in order to make sure we don't get sick. And I agree with that. It just, unfortunately, with the lower class community, I just don't feel like they had a lot of them didn't have everything that they needed in order to make sure that they stayed protected. And
and I agree. I think we've ramped up a lot of things, especially from my side of the house at DHHS. We can see testing has ramped up. We've seen contact tracing has ramped up. We've also seen the provisions for PPE or personal protective equipment has actually increased. We've been able to put face masks and face coverings in the community at a higher rate now. So things have gotten significantly better in terms of reaching the historically marginalized populations and communities because more resources have become available. And so when you get more resources, you can get more adherence to some of these guidelines that you were speaking of.
Absolutely. Well, thank you for being on our show. And again, tell them how they can find you.
Definitely. You can go to our website, www.ncminorityhealth.org. You can also get your latest COVID information from our ncdhhs.org website, or ncdhhs.gov. Sorry.
That's okay.
And then and other platforms, if you're looking for me personally, you can find me on LinkedIn, you can find me on Instagram, you can find me on Twitter. And so it's not hard to find people nowadays, but just appreciate this opportunity to be on your show and speak with you and your audience.
Absolutely. Well, I'm bringing you back on for the next show, so don't go anywhere. So, and we'll go a little bit more in depth about the conversation that we just had. Thank you for being on here. This is Doc Bowman, Discover the Best You. You can find me at dr.lbowman for Instagram and Facebook, and my website is discoverychirowellness.com. That's discovery CHIRO wellness.com. That's my business. And stay tuned, and we'll see you next time.
Pequeña is ya.